being remodeled. And that's where he lived. And these parents that I told you about earlier that did some of these visits to the hospitals, they would go up there and they'd wait for him in the hotel. And he got to know them and know their children, and said, we've got to do something about this. So this is Ronald Reagan, who was governor of California, signing the Lanterman Act on September 4th, 1969. It's very interesting because Lanterman isn't in that picture. And we don't know why. He might have been ill that day, or might have had a committee hearing or something. But he signed the Lanterman Act. And you might ask, why would two very conservative Republicans get together and put together what is unquestionably the most powerful piece of entitlement legislation in social services anywhere in the country? California is the only state that has that. No other state has it. If you go to any other state, and you came from Washington, and you asked a parent or a person with a disability, what's the biggest problem you have? They will all tell you the waiting list. Because in other states, if you need services, you go on a waiting list. And those waiting lists are getting huge because budgets everywhere have been cut back dramatically. I had a board member in Art Ventura that moved to Colorado to be with her son and her grandkids. And she took her daughter with her who was in our program. She had a disability. And 3 years later, she moved back. And I said, Shirley, what happened? She said, well, they had nothing for Vera. I waited 3 years. She came back to California and was able to walk right back into the program and get services. So we have a really very, very important thing. Ronald Reagan was elected governor in 1966. And he ran on a platform of what he called welfare reform. His vision was we have to reform welfare, get people off the dole, get them out of the home, train them, and get them to work. And Lanterman was the most powerful legislator in Sacramento. He was the chair of the Ways and Means Committee, which is now called a Budget Committee. And any bill that had funding with it had to go through the Ways and Means Committee. And basically, Lanterman made a deal with Reagan. He said, I'll give you your Welfare Reform Act if you give me my bill. And that's why this bill was signed. It's kind of interesting because we think of conservative Republicans not really being very supportive of social service programs, although Republicans have been very supportive of our kind of work. And that's a good thing about it because we are a bilateral program. So what did this bill do? It gave us the regional center system in California. They were established with community boards, not a state agency. If you read that law that I'm passing around, remember Lanterman and Reagan, and they said, we're not going to expand state bureaucracy. And so they intentionally said in the bill, because state agencies, and I'm kind of paraphrasing this, are not as efficient and responsive to the community in providing services, these regional centers will be private, nonprofit agencies with community boards. And each regional center will reflect what its community wants. And in the early days, all regional centers did just that. They were very, very different. I worked at Far Northern for a while. And Far Northern was very much involved in supporting large workshops and traditional programs. Then I went to Tri-Counties. They weren't so much into that, but they were really into behavioral and medical services because the two people that ran Tri-Counties were a medical doctor and a psychologist. And so each regional center kind of developed its own little character. There will be one regional center per 1 million population. And in California, what was the population in California in 1969? Anybody know?
I have no idea.
21 million. So they said, okay, we'll have 21 million regionals, or 21 regional centers. They do a contract annually. Now the original contracts were not, the Department of Developmental Services didn't even exist in 1969. The original contracts were with the State Department of Public Health. That was really very, very critical because they wanted to get away from the Department of Mental Hygiene that ran these large institutions. And the regional centers have intake, case management, and quality assurance responsibility. How many regional centers do we have today in California? Anybody know?
21.
21! We had 21 way back 40 years ago, and we still have 21 today. And that's one of the reasons I think that the regional centers have so much trouble. Basically, their workloads have increased dramatically, and their funding has been impacted. So where are you guys? You guys are right here, I guess, huh?
Yeah.
And you're in Valley Mountain Regional Center. I don't know much about Valley Mountain Regional Center. You work well with them? They're very supportive?
Yeah.
Well, that's good.
I work the whole life service now.
Yeah, you can do whole life services.
So it's very, very interesting that the regional centers, and you know, it's really interesting because a few years ago, they wanted to establish what they called a Trans-Sierra Regional Center. You ever heard of that one?
No.
Regional centers get criticized pretty regularly, and there was an audit of them a few years ago. And they looked at services here, kind of on the eastern corridor of California, and then what they found was that the people were most happy there with the regional center and their services. And that's largely because it's a rural area, people know each other, they're very friendly, and what this Trans-Sierra Center was going to do is basically, it was really a self-directed model. He said, well, what we'll do is we'll basically not have a regional center, we'll give all the funding to the individuals who receive the reports, and they'll work with an independent contracted case management system to get whatever services they want. It was really the first model for a self-directed service in California. It was called the Trans-Sierra Regional Center model or something. It went nowhere because basically the regional centers by that time, like everything else, have grown into large independent bureaucracies, and they didn't want to give up that concept. I still think self-directed services has a lot of merit and is something that people should be able to access. We do have a Medicaid waiver for self-directed services in California, but the department never does anything with it. Okay, remember I told you the first bill was for people, bless you, people with mental retardation only?
Yeah.
In 1973, 4 years later, the law was changed. And again, this was Frank Lanterman. We had, this was Ronald Reagan was still there, I believe then. No, he was gone, I think. I think we had Jerry Brown Jr. his first time. But we had a bill, AB 846, that added cerebral palsy, epilepsy, and other neurologically handicapping conditions. Called the fifth category, and the fifth category has been a nightmare for the regional centers for a long time. Basically, it's people who have a trauma through an accident or something like that. I know you probably have some of those folks in your programs. And then again, the program was changed in '75 to add autism. Now, I'm going to talk a little bit about autism. I was working in the regional center system by this time, and autism was really a very rare case for us. With about 1 in 400 cases, and I was a director of case management at Tri-Counties, was a person with autism. Didn't know much about it. We still don't know a whole lot about it. The only thing I know about it is there are a lot more people with autism now entering the system. And about 50% of them, or actually more than that, about 80% of them are under the age of 21 and are going to be hitting your adult system. In some regional centers, it's now 1 out of 3 intakes is an individual with autism. So it's really going to overwhelm our system in a few years. All right, now this is a story that we should be pretty familiar with.